Well, hello, and thank you for joining us for our webinar, Modernizing Intake and Reducing Staff Burden, the third and final webinar in our three-part Front Office of the Future series. I'm Adam Rubenfire, a content manager at Phreesia, and I'll be moderating today's presentation. Today, we'll share how healthcare organizations are adding the convenient intake features that patients have come to expect, increasing efficiency and reducing staff burden. Before we get started, I'd like to quickly share some housekeeping notes. You can submit questions at any time using the Q&A widget at the top left-hand corner of your screen, and we'll get to as many as we have time for. In the resource widget on the left-hand side of your screen, you'll find two one-pagers, one offering an overview of Phreesia and the languages we offer for intake, a white paper about mobile-first intake, and a blog post about why providers should implement digital check-in. If you have any technical difficulties, please click on the help widget. It has a question mark icon and covers common issues. If you're still having trouble, feel free to chat with us via the question icon, and we'll do everything we can to help you. But since it's always one of the most frequently asked questions, this session is being recorded, and you'll receive a recording by the end of the week. Our session today is going to start with a quick introduction of our panelists in Phreesia. After that, we'll discuss how to improve intake and streamline the patient experience without burdening staff. Finally, we'll spend the majority of our time in a Q&A discussion with our guests about how they're doing just that. And speaking of our guests, I am so thrilled to introduce our speakers for today. Sarah Barnes is front office manager at Northside Pediatrics, located in the Atlanta area, and has been with the practice for 20 years. She's been in the industry for 25 years, previously working in a multi-specialty practice in Wisconsin. Belinda Pitts is the billing office manager for Elite Women's Care. She has worked in healthcare for over 25 years, is a certified procedural coder, and has extensive experience in front office operations and revenue cycle management. Thanks, Belinda and Sarah, for being here.
Thank you, Adam.
Of course. All right. Before I begin the presentation, I'd like to offer a few brief words about Phreesia. Phreesia is a technology company guided by our mission of creating a better, more engaging healthcare experience for patients, providers, and staff. We have real-time integration with all the leading EHRs and registration, scheduling, and billing systems. We're a publicly traded company on the New York Stock Exchange. We've been named the top-ranked patient intake company by the Research and Insights firm KLAS for 4 years in a row, and our security and privacy efforts are recognized with the industry's top certifications. If you're interested in learning more about Phreesia, you can request a consultation using the drop-down on the right-hand side of your screen or visit phreesia.com. Now, let's talk about patient intake. So I want to start with some of the challenges we hear from some of your peers who may be using antiquated or outdated intake processes. First, we see a poor staff experience. Staff are intimately involved in the traditional intake experience. They're scanning or transcribing paper forms in the EHR. They're talking to patients and through the paperwork that they're doing in the office. This manual work, that can be very time-consuming and burdensome. And ultimately, that leads to inefficiency as staff are taking data from paper or disparate systems and transferring it to the EHR by hand. That time could be better spent solving for patient issues and making visits more personal. I don't have to tell you how dissatisfying the intake process can be for patients. They often have to arrive early, sit in a waiting room, fill out pages and pages of forms and consents, some of which they might have already filled out on their last visit if there's not a clear process in place. Intake often isn't customized to the patient or their appointment type, and that leads to all kinds of redundancies and a waste of time, really. And when the patient gets into the exam room, their provider may not have the information from their intake forms just yet, especially if staff are backed up. When paperwork is simply scanned and the data isn't transcribed, it's also hard to digest and sometimes stored in multiple places. So clinicians have to ask repetitive, often simple questions instead of having a meaningful conversation about clinical or social needs. Finally, because patients aren't checking in for their visit ahead of time and engaged about their care, they're more likely to no-show or cancel at the last minute. That leads to reduced profitability, and that can have a ripple effect across all of these other factors. So what does a state-of-the-art digital-first intake process look like? Well, it starts with allowing patients to complete intake themselves and check in for their appointments from anywhere, at home, on the go, or in their provider's office if they prefer. That provides patients the convenience they expect and takes the burden off staff. Healthcare organizations across our network who enabled patients to check themselves in prior to their visit saw their no-show rates go down by 82%. It's a big number. So this is most often done via a patient's mobile device, a smartphone. It could be an iPad as well, though, but it can also take place via a tablet device or in your organization's existing digital front door via API integration. So, whatever you're using on your website, integrating forms into that. In-office devices like Phreesia pads are often useful in engaging patients who might be less comfortable with technology and would like a little bit more of a personal touch with your staff. Because patients are using mobile devices, the more patients are using that, we're going to talk about that in a sec, but because they're doing that, you're going to save some time. So, but this solution, this isn't complete. This isn't end-to-end if we're not giving staff robust tools as well. All of this information that patients are inputting needs to be easily accessible to staff. Their dashboard should make it easy for them to quickly determine who's checked in, whose eligibility and benefits have been verified, and who may need to be flagged for follow-up. There should be easy icons to figure all that out. And plus, when a digital intake solution offers you analytics data on your patients and their use of your platform, you can improve efficiency and make the most of your investment in digital tools. Now, I want to just quickly talk to the importance of customizing the intake process, which can save staff and patient time. In this case, we're looking at how digital intake can be customized for Anna and Camilla, two patients at an OB-GYN clinic. First and foremost, it's worth noting that with digital check-in, we're collecting data that's not only specific to the OB-GYN specialty, but also to this specific organization to ensure staff are getting all the information they need and not asking any unnecessary questions that would prolong the process. But we're also customizing each patient based on age, appointment type, chief complaint, and a range of other factors. For example, we'll ask Anna to sign a number of consents and answer some introductory questions because she's new to the clinic, but Camilla has been here before and that's recognized in the system, so she's not going to be prompted to sign any further consents today. That's automatic. It's all happening in the background. There's no staff required, no questioning of, if this person did consent. Each patient is being administered different patient-reported outcomes and clinical screening tools based on the specific of their visits to providers. And Camilla is being prompted to schedule her annual mammogram based on the timing of when she's visiting. She does that right in the intake process. One other thing to note, Anna's primary language is Polish. To make sure she understands what we're asking of her, we can offer her intake experience in that language. You can take a look at the resources widget on the left-hand side of your screen to see other languages that we offer. And between either of these patients, language may not be the only issue. Literacy might be too. So we need to make sure that the questions we ask of patients and the information we're providing during this process is at a simple reading level. We recommend 6th grade at most, and that ensures that your screening tools, your PROs, you're getting results that you'd expect, that you intend, and that patients are giving information that makes sense. This level of customization provides for more meaningful visits and more comprehensive data. And really, a lot of this customization wouldn't be possible without a sophisticated digital intake solution. So I just want to take one more moment to talk through a survey we conducted of 4,000 patients earlier this year, just to show you that online check-in really is something patients are seeking from their healthcare organizations. It's an expectation and a competitive differentiator. So 16% of patients told us they'd consider switching doctors if their physician doesn't offer online check-in. That's significant because leaving your provider is a drastic move and shows how much patients care about this technology. Patients told us as well that they prefer online check-in for a number of reasons. 61% said because it's more convenient. That same number said they would also spend less time in the waiting room as a result of online check-in. 59% said it's faster than checking it on paper. It's also worth noting that the future is in mobile. An overwhelming 84% of patients told us that when they check in online, they do so on their smartphone or other mobile device. So the data shows that online check-in is a preference from patients. It could be a competitive differentiator, if not a requirement for healthcare organizations. But enough about the survey, about what we think is the right intake experience, because I'm excited to talk to Sarah and Belinda about what they're doing to improve intake at their organizations. I'm going to take our PowerPoint off and show our panelists lovely faces. Sarah, Belinda, thanks so much for spending time with us today. I want to start by asking you to share a little bit about your organizations and the patients you serve. I would love to start with Sarah. Can you tell us a little bit about your organization and the patients you serve?
Yeah, we work at Northside Pediatrics. We see patients from newborn to 21. So from birth to adolescent, we see them all. Yeah, so it's a range.
Wonderful. Belinda, what about you? Tell us
Yes,
about your, yeah.
yes, I'm with Elite Women's Care here in Norfolk, Virginia. And our practice consists of all female specialists and OBGYN. And we provide care to women through all stages of life as well, from young teens through their senior years.
Wonderful. Love it. So great to hear from you both and have you both today. We're talking about intake. So I want to understand why it's important for you to optimize the intake experience. You do invest in technology for a lot of processes in your organization, but I want to understand why patient intake is a priority and why you've paid attention to kind of digitizing it and making sure it is, it's a sound process. So Sarah, I'd love to start with you on this one. Why is intake important for you?
I mean, I think it's important not only for us, but also for the patient. They want to spend time at home with their children. They're coming in here. They want to get the best care that they can. They don't want to have to be filling out paperwork. And, especially for us, you've got kids that you're trying to wrangle in the waiting room, or over the last couple of years, with COVID, we've been having them wait in their vehicles. So they are wrangling them in the car. And so it's best to get this stuff done before they come in. So to prioritize it, on their phones and get it done ahead of time, they're loving it.
Mm-hmm.
That's great. Belinda, what about you?
Yeah, Sarah is absolutely correct. I'm going to speak from a billing point of view, where intake is very important, primarily because it's the process that we use to make sure that information that's required to bill for services that are done is collected accurately. Our number one priority, of course, is patient care. However, we can't forget that the providers want to make sure that they get paid for the services they provide. So we must invest in a better process. To me, the front office is one of the most important parts of the medical office. And like Sarah said, patients come here to see the doctor. They don't need a great deal of interaction during check-in. So of course, optimizing the intake process makes for a better visit.
Love it. Love it. So for both of you, patients now provide their information directly to you online rather than on paper. And I want to understand how that has impacted the completeness and accuracy of your records. I'll start with you, Sarah, because I think you've seen us through Phreesia's implementation, right? Like you've brought Phreesia into your practice. So I'm just curious what that's been like to go from, to make sure that your patients are doing things on digitally and not on paper.
I mean, at first it was a struggle with the patients. I won't lie.
Yeah.
They didn't like it at first, but no. I mean, now it's wonderful. I mean, I think they now as the years grow and everything is becoming more app friendly, and everything is more technology. They love it. And the forms are being done ahead of time, and they're spending less time. Like I said, doing this stuff, they're able to pay their copays, the balances. I mean, everything is done ahead of time. They're not having to do this as they're sitting here. It's minimal time left in the office.
Got it. And Belinda, you came to your organization with digital check-in already implemented, but I'm sure you've worked with paper-based check-in before. Like, tell me a little bit about kind of where you see the differences are and how you think it improves, especially for billing, how it makes sure that you have more, better information.
Yeah, absolutely. Again, I must agree with Sarah. Paper, we've come a long way. But again, technology, telephones, tablets, that's the time, that's the time we're in right now. So that's what people are using. And even if you just try to collected information over the phone without people having to write anything down, it's very easy to hear the wrong thing. So if the patients are able to enter that information themselves, least likely to make a mistake. And I think they'll be glad, of course, it's done already before they get here. They can do it in the comfort of their home. Sometimes they get here early, they sit out in their car and do it. So yes, digitizing has brought us a long way from paper.
Yeah, I mean, and Sarah, to your point, change isn't always easy.
No.
It's not, I mean, how have your patients like, did you find that you just, over time, as you've educated your patients about the benefits to them, that you've been able to ease into it?
It's funny. It also depends on your demographic.
Sure.
Because we have two different offices, and our office up here where we are, they've been able to move with it, but our other office closer in the Atlanta area and that demographic down there, there's still some pushback. So it really depends on your demographic and, what they want to do down there, or, where you are. And I'm sure with Belinda, like maybe some of the older generation, they're still giving you some pushback.
Yes, that's what I was going to add. Our older generation, we still keep the little pad on the side for when she comes in. She's like, now, I don't know how to work this. Okay, don't even worry about it. Here you go. We're going to help you with that. And that just makes their day. They don't mind. Some of our older ones show up 30 to 45 minutes earlier for their appointments just because they know they're going to need that type of help to get checked in. So it's not a problem.
But Belinda, do you think because you have so many other patients using mobile, do you have more time to spend with patients like that?
Absolutely, because suppose I have 3 people in line and only one of them is an older person. So I've already looked at them. Okay, yes, you did pre-check-in. Thank you. Have a seat. Appreciate you. Then I have Miss Ann over here. I can take the time that I would have spent on those 3 people on helping her. So yes, it helps. It works.
That's great. Yeah, the data, we've done a number of surveys on this, and the data shows us that, with older patients, they're willing, they just could use a little bit of a personal touch, but you don't have time for that. Right. if when you're dealing with a lot of other things. But if you are able to kind of shift some of this input onto patients, which by the way gets you more accurate information because it's coming straight from them, you've got time to get that. And ultimately, I think that's what a lot of your staff get into this job to do, right? Is to work closely with patients and care for your patients.
Absolutely.
So
Adam,
go ahead, Sarah.
If I can add one other thing, when we started out with Phreesia in 2017, I believe it was, we had 6 pads, I think it was, in office, and we have gone down to 2 pads per office. And that because we have so many people are doing it on our phone that we just don't need those orange pads because they're doing them on their phone. So I mean, that says it all right there, and how many people do use their phones.
Yeah, we love our Phreesia pads. We've got a new Phreesia pad, and this is a shameless plug, new Phreesia Pad X coming out soon. But to your point, Sarah, like mobile is very important, and it's something that we we do think patients want to do things on their own, and the Phreesia Pad X and our pads in general are just a really great tool for those of patients who choose to do it in office, and make it easy for your staff if they want to help a patient, walk through it. But that's a great point. Sometimes we do see offices say, mobile's working really well, and the pads are great, but they're for these patients. So that's wonderful. Right. I want to also talk about consents, because as I mentioned earlier, when we see that consents are paper-based, many organizations are either unnecessarily, asking patients to sign consents that they've already recently signed. Patients aren't signing consents sometimes, which is a huge major liability. I'm wondering what your consent process is like now and how it's helped staff. Belinda, I'll start with you.
Well, with the intake process through Phreesia, patients give electronically or digital consent. Therefore, we can rest assured that before they even cross over the threshold into our clinical area, we already have permission to treat and we have permission to bill. So that is an assurance. That assurance is definitely a relief. And if there's any other type of consent, there are forms in Phreesia that we can pull later as well. But primarily permission to treat, permission to bill, we get that right off the bat, and that's great.
Yeah, when you told me you don't I was like, it's like Belinda standing there, you shall not pass, until you've I love that. That's great. But so Sarah, I'm curious with you, what's your consent process like? Do you feel like it, having that digitally, frankly, nobody's keeping track of it, right? The system's just delivering it when it needs to.
Right. Yeah. So, it's great because we were doing it before once a year. So if you had somebody come in, December 27th, Well, when they came in January right away, you were having them fill it out. And they're like, well, I was just here last week. I filled it out. Well, sorry, the year started over. So here you go again. Now
Yeah.
this way, we don't have to keep track of that. They're filling it out. It's great because Phreesia gives you a little mark that says, oh, they declined this. Well, when they come in and they declined it, then we give it to them in paper. Well, if they still decline it, then sorry, we can't see you.
Huh.
You either sign this or we're not, we won't see you.
That's a really interesting point. It's, it gives you an opportunity to educate the patient too and say, I just want you to understand what this consent was.
Right.
Yeah, that's really helpful.
Mm-hmm.
Belinda, you've talked to me about some of the staffing challenges you've faced, as I'm sure our audience has as well. It's a lot of organizations have been, challenged by staffing shortages. And you shared that you're saving time with digital intake. What do you feel like technology is giving your staff more time to do, and how has it helped you mitigate the impact?
Okay, well, the practice did go with Phreesia in the midst of the pandemic due to the shortages. But prior to that, we had a plethora of things that needed to be done. Insurance verifications, patient reminders, rescheduling patients. Our doctors are, they deliver babies. So if a baby's coming, doctor has to go. We have to shift over. So with having Phreesia and some of the subscriptions that are involved with Phreesia, it helps. It helps with the staff. So Phreesia does our insurance verification. If an opening comes up on the schedule, Phreesia can contact that patient and say, hey, you have an appointment out here, but we have one here. Do you want to come in? So it can move the patient up. So rescheduling, reminding, verification, of course, pushing out that in pre-certification or pre-registration for them. All of that has helped because those are tasks that our staff would have had to do manually. So yeah, that has definitely helped our staff, and they appreciate that. Because it has been overwhelming. I think if we take Phreesia away, because it's like an employee to me, and if we take it away, we may have to hire another, maybe even two. And I don't think our staff will be happy with that if we take it away from them. So yes, it has been great for the staff. They love it.
Well, and that's the thing, right, Belinda? It's not like you're replacing an employee. You'd have to hire more employees, and it's not that easy to find another employee, right?
It's not. It's helping. It's definitely helping. And I think it's helping with retention too. So.
Oh, really? That's great. That's great. Yeah, I've actually heard folks mention, in a job interview, they've said, oh, you're working on paper right now? Oh boy, don't worry. Like if you come work for us, we've got this. So that's wonderful.
Yeah.
Awesome. Well, Sarah, you've mentioned to me that your organization recently started doing all of your new patient paperwork on Phreesia. What's that been like? What kind of benefits are you seeing from that transition?
It's great because they're not spending 20 minutes here in the office filling it out. And it's all filled out by the time, when they get here, the front prints it out, we give it to the doctor already has it in, or we give it to the nurse, and the nurse is putting it in the chart. And by the time the doctor gets in there, they see, their past medical history, they see their social history, it's all there for them. So, we've noticed that if they don't do it before they come in, it takes them a good 20 minutes to fill out Phreesia because they're putting all that stuff in. So that's, then they're behind schedule. So it's been a big help.
And meanwhile, if they do it beforehand, they can kind of do it as they go, during their day and make sure that they're filming everything out. That's wonderful.
Yeah, especially for the newborns, it's awesome because, with newborns, they're not on time anyhow. They're just getting out of the house with that baby. We're lucky if they get here on time. So.
Well, and Sarah, a lot of that too is with newborns. I assume the parents are coming in, but I know with younger children, sometimes it's not a parent who's bringing the child in. It could be grandma or somebody. So the ability for the parent who knows everything to fill out that information, but for somebody else to bring them in is a pretty important thing.
It's a grandparent or an aunt or even a sister sometimes, or the nanny. So it's great because the parent gets to fill it out before they come in, or with Phreesia, because it sends it out 3 days or what parameter you have it set up to, the parent gets it that day, whatever day, and they get to fill it out along with the copay if they have one, or balance, and all that gets paid prior to.
Sarah, a great transition because I'm going to talk about copays and balances.
I do that.
Well, before I do that, though, I'll just say, audience, if you have any questions, send them in via the webinar platform. If we don't get to your question today, we have the ability to kind of forward them on to our lovely panelists here who can help answer them if you have questions. But I do want to talk about copays and balances because you both collect copays and balances during the intake process. I want to understand how that has helped operations, and who better to start with than Belinda, whose main focus is billing.
Absolutely. The ability to catch the money on the front end has certainly been very helpful with me and my AR. I mean, you know, once the claim is billed out, patient's already paid her portion, insurance paid their portion, zero balance for the patient, less statements that we have to send out, saves money on all ends. So yes.
I love that. Sarah, what about you? Are you seeing better results with the bottom line and collecting more payments?
You know, I can't truthfully say because I don't see that part because that is
Okay.
our billing office. But I mean, I know that we do collect a lot of balances. It helps definitely with our deductible because we do collect half the office visit up with the deductible. Phreesia with, you know, that stuff, that is very easy to read compared to what we had prior to Phreesia. So our front is, you know, can read all of that stuff. It's very easy to read. I mean, I love Phreesia. It's been my baby.
Yeah, and Sarah, if I may add, Adam, Sarah made a good point about being easy to read. I mean, my front desk staff, they're not trained in billing, but they're trained on Phreesia and they're trained on what to look for. So it's very easy to see exactly what the patient's responsibility is. So,
yeah, we're looking for that quick, you know, at a glance views, you know.
Yeah.
So perfect. Awesome. I got one more question for y'all, kind of a quick one piece of advice. I'm looking for one piece of advice to someone who is just starting to consider digitizing their intake process or upgrading their current digital process, because, you know, we've got representative of both groups here. You know, what would it be? What would your one piece of advice be for somebody who's looking to upgrade their technology or implement new technology? Sarah, let me start with you.
Just do it. Just do it. I mean, it's a millennial world. And I mean, if you do any of your research, you're going to see that the millennials want everything technology. They want it all there. They want it here in their hand. They want an app. They want to be able to do it. They want it their way. I mean, I know I just hit a bunch of slogans, Burger King, Nike, whatever, but I mean, they do. They want it here. They want it now. And they want it there. I mean, they want it their way. I mean, if you do your research, everything's going to show you that.
And Sarah, I think at a pediatric practice, you're probably seeing what a lot of practices will see down the line, you know, because you're with the parents who are, you know, of children who are probably, you know, mostly millennials, you know,
Yeah.
Maybe a little bit older, a little bit younger, but you see a lot of the trends, maybe even before other organizations. So
yeah, and probably with OBGYN, it's kind of hard to do, you know, those type of things, you know, telehealth and all that. But I mean, it's, you know, they want it here and now. They want everything catered to them.
They do.
Yeah. Belinda, what about you? What's your one piece of advice?
Again, I'm going to come from the billing perspective. Think about what's important, what's most important in your office, and how can you ensure that your provider will get paid for the work that is done. That is sure to happen if you have the most accurate patient information. Your claims are sent out clean the first time, and that starts with your front office. So front office optimization is the way to go. Intake is the way to go.
I love it. Love it. Love it. Love it. Well, thank you so much to our panelists, Sarah and Belinda, for joining us today. That's all the time we have for today. But Sarah, Belinda, it was so great to be with you. Audience, if we didn't get your question in the chat, if we didn't get to your question in the chat, or if you have any questions about Phreesia, please don't hesitate to request a consultation using the form on the right-hand side of your screen. We'd love to be in touch. This is the final webinar in our 3-part Front Office of the Future series. It's been a pleasure moderating this series. We've gotten such great questions, so many great listeners coming in. And if you liked this and you want to see the other 2 webinars in the series, check out the resource widget on the left-hand side of your screen. We've got links to those other 2. But we, Sarah, Belinda, thank you so much for your time today. Thanks to our audience for tuning in, and have a great day, everyone.
Thank you.
Thank you.